going there this week. I'll let you know. Huh? Tonight? On that crane? Oh, what time?
As we welcome the Honorable Premier, Premier Sihle Zikalala of Natal, joined here by the MPC for Health, almost said a terrible twin, MPC for Health, MPC Zikalala Zulu, and today we also have the MPC for Education, is also back with us at this briefing session. Yeah. We are going to be receiving all the latest with regards to COVID-19 and the reopening of schools in KwaZulu-Natal. We welcome all of you, and without any further delay, I am going to be requesting that we head over to the Honorable Premier to take us through the business of today.
Thank you, Mr. Lennox Mabaso. Greetings to all of you, ladies and gentlemen from the media. MEC for Health, Honorable Nomagugu Smelane Zulu. MEC for Education, Honorable Kwazim Shengu. Officials from various departments, distinguished guests, we once again welcome you to this media briefing. We will never get tired of acknowledging you and expressing our gratitude for your invaluable partnership in this epic battle against the COVID-19 epidemic. From tomorrow, the 24th of August, all schools across the province of KwaZulu-Natal will open gates for the return of all the grades. This will see the full complement of 2.8 million learners returning to 6,148 schools in the province. With the exception of grade 12, 11, 7, and 6, all other grades will be returning for the first time since March 2020. The Department of Education in the province of KwaZulu-Natal has thoroughly prepared for the full opening of the education system. All PPEs, personal protection equipment, and other essentials have been procured and delivered to all schools. There are only 3 districts that have reported that they will complete their delivery either tomorrow or either today or tomorrow morning. We must indicate that the outstanding delivery is due to cancellation made when certain appointed service providers could not deliver on time. However, we are confident that every learner will return home with 2 sets of masks. The return of all grades in our school has also meant that the department must employ other mechanisms to ensure social distancing. The department procured mobile classrooms for selected schools across the province, where even differentiated timetabling could not assist in keeping social distancing. All the schools will have to operate at 50% capacity and alternate the attendance of grades. From tomorrow onward, the attendance of grades will be as follows across all schools. Monday and Tuesday is grade R1, 6, 10, and 11. Wednesday and Thursday is grade 2, 5, 8, and 9. Friday, grade 3, 4, 10, and 11. Beyond this week, the schools will then apply their differentiated timetabling based on their individual circumstances. We further emphasize the point that the safety of learners, teachers, and management team it remains a priority in everything that we do, and we will not compromise the standard. On the provision of water, the consistent provision of water to all schools continues to be a priority for the department, working with municipalities. As part of ensuring a sustainable solution, the department has started a program of drilling boreholes in schools, and this work is undertaken through Public Work and IDT. Currently, 600 schools have been identified for the immediate drilling of boreholes, while studies are conducted to ascertain the availability of underground water in other schools. And the process will go on. Our intention is to cover all schools in KwaZulu-Natal. On the National Schools Nutrition Program, the department has identified a number of improper kitchen structures in a number of schools across the province, which have become a health hazard to learners and food handlers. Consequently, the department has procured 317 kitchens for the prioritized schools, and the delivery is already taking place. Let us then come back to the business of the day, which is the update on COVID-19. Although we are seeing a remarkable reduction in the number of infections in our province is still the second most affected when it comes to the prevalence of COVID-19. We are second after Gauteng. Since last Saturday, KwaZulu-Natal registered 4,713 new cases and 276 deaths. The average daily infection rate is 198 cases per 100,000 population, which is a dramatic improvement from 309 per 100,000 population, when we were registering about 3,750 cases daily. And it shows that the daily cases is decreasing. We are very clear, however, that even if our statistics are showing a downward trend, a COVID-19 infection or death is one too many, and that must still be understood as such. The province currently stands at a total of 109,337 cases, with 1,949 deaths and 85,055 recoveries. The median number of cases reported in the province since the beginning of August was 1,411 cases daily. Of the 544 new cases recorded on the 22nd of August, eThekwini recorded 43%, and it was followed by Umgungundlovu at 18%. There is a remarkable decrease in average daily cases from 2,289 since the beginning of August to 670 currently. With regard to fatalities, KwaZulu-Natal recorded 13 new COVID-related deaths on the 22nd August. Of the new reported deaths, King Cetshwayo district reported 54 of the deaths, and that is the highest. The province has a cumulative total of 1,949 deaths. Since the beginning of the pandemic, the eThekwini Metro has contributed 48% of the reported deaths. The proportional age of the deaths remained at 62 years. Slightly over half of the deceased patients were females. The most common recorded comorbidity amongst deceased include hypertension and diabetes. With regard to the distribution of cases and deaths in KwaZulu-Natal, in the new cases reported, the total is 544, but we can then report that the new cases in eThekwini is 237. The total cases in eThekwini currently is 50,937, and the deaths in eThekwini are 934. In Ilembe, where by yesterday we recorded 24 new cases, and the total number is 5,505, the deaths 55. Umkungundlovu, new cases 57, the total is 14,468, deaths it's 322. Uthukela, 27 new cases. The total number of cases is 4,754. Deaths, it stands at 100. King Cetshwayo, new cases 98. The total number of cases 8,745, and fatalities is standing at 176. Uku, 16 new cases recorded. The total number of cases is 4,442. 82 recorded deaths. Amajuba, 30 new cases, 6,225 total number of cases, and they've recorded 98 deaths. Umkhanyakude, 18 new cases, 2,189 total number of cases, and 43 deaths. Hirikwala, 8 new cases, 2,143 total number of cases, and 49 deaths. Zululand is 19 new cases, 4,548 total number of cases, 44 deaths. Mzinyathi, 4 new cases, 2,408 is the total number of cases, then 48 deaths. So that will then have 6 cases that are not allocated in the province. So if all is calculated, the new cases by yesterday is 544. Total number of cases in KwaZulu-Natal since the outbreak of COVID-19, it's 109,332. The deaths are 1,949. Even though the number of cases seems to be going down, we are still very concerned about the number of patients who are not presenting themselves early enough to healthcare facilities. We appeal to all our people to know that COVID-19 is not a death sentence. The highest number of recoveries confirm that with the early detection, lives can be saved. In the same breath, we would like to urge those who manage both public and private institutions to ensure that they leave no stone to chance and sanitize and decontaminate public areas regularly. In terms of incident risk by district per 100,000 population, the overall incident risk for the KwaZulu-Natal has been declining since the beginning of August and currently stand at 198 cases per 100,000 population. eThekwini district has been receiving a proportion of 662 cases daily. Umkungundlovu district has been receiving a median of 170 cases daily. Amajuba district has been receiving a proportion of 82 cases daily. Worryingly, King Cetshwayo district continued to be the district with the highest infection rate, with 361 cases per 100,000, followed by eThekwini. At least 6 districts have an incident risk of 100 cases per 100,000 population. In terms of admission and isolation in hospitals, on the 22nd of August, the province had 1,449 patients admitted in both private and public hospitals. 71%, which is 1,029, were in private hospitals, while 29%, which is 420, were in public hospitals. Of those admitted, 294 patients required intensive care services, and that is 20%. Private hospitals had more patients in ICU than public hospitals. In fact, private had 87 in ICU, and the public had 13% of patients in ICU. Among those required intensive care, 53% were ventilated. Other patients were admitted in high care unit in both private and public facilities. Inkosi Albert Luthuli had majority of patients admitted in intensive care unit. Majority of ventilated patients were admitted also in Inkosi Albert Luthuli. Out of the 5,885 healthcare workers who have been infected with COVID-19 since the beginning of the pandemic, more than 60% have recovered, and we would want to commend that. Of the total infected, just 1% have unfortunately succumbed to the disease. Infected healthcare workers and their outcomes between March 5 and August 21, in terms of cases, public health facilities had 4,304 cases, and about 39% is active. Private health facilities had 1,581, and 18% is still active. The number of deaths, public health facilities had 50 deaths, while private health facilities had 77 deaths. In terms of recoveries, the overall proportion of recoveries for the province is 78%, which is 85,055. We also want to take this opportunity to wish and congratulate Prince umntwana wakwaphindangene inkosi uMangosuthu Buthelezi on his recovery from COVID-19. His illness had been a great concern for us as the province, especially given his advanced age. We are therefore immensely grateful to the Almighty for answering our prayers and giving him the strength to successfully fight the disease. He is also turning 92 on Thursday this coming week, and we wish him a happy birthday in advance. We also wish all other healthcare workers a speedy recovery, those who are affected. In terms of the impact of the inter-provincial travel, we are very pleased to see hotels and conference centers reopening their doors and accepting customers alongside the restaurant and other places and sectors that are now back in business following the easing of the national lockdown. While it is still too early to speak about the impact of this, we are seeing indications that the economic activity is on the increase from these key sectors of our province. As we all know, the tourism and hospitality sector is among the biggest contributors to the job creation. We wish to urge those who run these establishments, as well as their visitors, not to compromise when it comes to COVID-19 safety precautions. We will, as the province of KwaZulu-Natal, sooner be launching our economic recovery plan that will be our lodestar as we rebuild our economy and strive to create more jobs for our people. At the same time, we want to take this opportunity and remind our fellow compatriots that COVID-19 is still a part of our life and that the national lockdown has not ended. We are closely monitoring the impact of inter-provincial travel, which effectively means that there are now more vehicles on our roads, as well as relatively more free movement of people as the economy increasingly open. This carries with it a high risk of person-to-person transmission. People may be tempted to think that COVID-19 is no longer a threat, which is very far from the truth. As we have said before, a second and a strong wave of COVID-19 infection is something that we cannot afford. We have seen this in other countries, and we must learn from such painful experiences that they've gone through and try to do all we can to avert the second wave. As we conclude, we appeal to our people to fully embrace our new normal and exercise caution at all times. Non-pharmaceutical interventions are our greatest weapon against COVID-19. Wear your mask wherever you go to the public. Sanitize or wash your hands with soap and water, and keep the 2-meter social distancing at all times. Do not engage in risky behavior. As individuals, we are now the only ones that can make the difference. Let the compliance with the regulation to fight COVID-19 be part of our DNA. Whether you are young or old, we are all still at risk of being infected with COVID-19. Hugs and kisses are still a form of risk behavior. Let us protect ourselves and protect our people, especially the elderly and those with comorbidities. We also appeal to people to continue taking their medication for chronic illness, such as diabetes, HIV and AIDS, among others. We appeal to employers to allow people with proven comorbidities to work from home, and to families to minimize contact with the elderly, as they are presently a high risk of being infected. Government has worked hard to create thousands of beds for quarantine and isolation in record time. There is still a lot of space available. So if you notice any symptom of COVID-19, please do not delay. Reach out to a healthcare facility so that you can be screened and tested as soon as possible. These symptoms may include fever, dry cough, tiredness, or loss of smell or taste, among others. It is important, it is much better and important to be quarantined or isolated at a government facility than at home, because should COVID-19 related complications set in, if you are in the healthcare facilities, it will be better and easy to get help within the close and short space of time. The contact details on how to get yourself booked in one of these facilities are available on the website of the Department of Health, which is www.kznhealth.gov.za. And it is also available, the contact details are available on the social media pages of the department. This is not time to be complacent, no time for risk behavior. It is now in our hands to work together to beat and conquer COVID-19. I thank you.
Thank you very much, Honorable Senior. We move to questions. I'll start with the colleagues that are here. Sihle.
Mayelana ne Okay, mayelana nendaba yokubuyela kwabantwana esikoleni bengisacela ukubuza kakhulukazi kumhlonishwa umshengu ukuthi kuzokwenzalakalani kulabo thisha laba abaninkinga zempilo abangakwazi uku-attenda esikoleni kuyofundisa abantwana. Abantwana ke laba bazobe bekhona iluphi uhlelo mhlambe esingathi umnyango unalo ukubhekelela lezo ikhala zabothisha abangazokwazi ukuthi babe sesikoleni kufundisa abantwana. I wanted to ask something. Oh, okay. Okunye bengifisa ukubuza ngizwile ukuthi uNdunankulu uye wabekwa wathi kukhona ilokhuzane ama PPEs angakatholakala ezikoleni angakafika angakadeliver through some lokhuzane ngenxa yeinkinga ethize. Mhlambe lezo izikole zizokwazi ukuvula noma ama PPEs engakafiki engakadeliver. Ile umbuzo wami ngiyayibongela.
I want to deviate a little bit from the briefing. There was an investigation that was being done by the Premier's office with regard to the PPEs. Can the Premier maybe update us on that investigation and what has happened to the employees who might have been implicated maybe in the procurement of that of those PPEs?
Can I please have this question asked to the Premier? Education. Will all schools be able to welcome additional credits tomorrow? Is there any update on the substitution of teachers with comorbidities? If so, how many additional teachers are being recruited? Another one from what's corner, which relates to health, health, given that the rate of infection is going down, is government considering diversifying or disinvesting from some quarantine and isolation sites in a bid to save costs? I think those are the ones we have so far. I think I'll hand over to the other.
I think we should know the opinion.
Well, good afternoon, Premier, Mrs. Melane Zulu, and all the colleagues. Well, on the question asked, let me start with the last one, whether all schools will be able to open tomorrow, and what will happen to the schools that we have reported that about 3 districts have not, as at yesterday, received the full complement of the masks in particular for the learners. Yes, all our schools are ready to open tomorrow. The procurement that we have done for learners' masks as well as the other essentials. Has actually been made so that all the schools are covered. Let me explain the outstanding districts. We have had a problem where the appointed service providers actually turned out that they were not ready to deliver. Some of them indicated that they can only deliver next week because they don't have stock. Others were still waiting for the material. Others indicated that they were still awaiting for the approval of funding for them to be able to do work. Unfortunately, we could not wait for such because we have our own target as a Department of Education. So those were forced cancellations, and then the department had to enlist other service providers to then deliver on the outstanding masks in particular. So the 3 districts were affected by those circumstances, but I am aware that today the delivery is continuing, and if it is not completed today, definitely tomorrow. That's why we are saying that each and every learner that will come tomorrow will go home with the 2 sets of masks, because definitely by tomorrow, if not completed today, the delivery will be completed tomorrow morning. We are seeing not all grades will come at once because we are also managing the issue of social distancing. Tomorrow and Tuesday, we're expecting grade 1, grade 6, grade R, grade 1, grade 6, grade 10, and grade 11. So those are learners that will be in school tomorrow and on Wednesday. So if you are doing grade 2, don't come to school tomorrow. If you are doing grade 5, don't come to school tomorrow. If you are doing grade 8, don't come to school tomorrow. We are expecting grade R, grade 1, grade 6, grade 10, grade 11. Then on Wednesday and Thursday, we are expecting grade 2, grade 5, grade 8, and grade 9. And on Friday, we are expecting grade 3, grade 4, grade 10, and grade 11. Then the following week, the schools will then have acclimatized and will then be following their own differentiated timetables. You will recall, colleagues, that I think we had reported before that all schools should be operating at 50% capacity so that we are able to maintain social distancing. And then the issue of the differentiated timetable then came into being. So schools will be alternating grades from the following week. The school will follow its own timetable, but we had to guide them during this week so that there is no confusion in regard to the grades that will be in schools during this week. Insofar as teachers with comorbidities, the process is unfolding. We received 5,979 applications for teachers who were applying for concession. And let me explain that they were not applying for leave. They were applying for concession so that they can continue to work at home. So it's not leave, it's concession. And out of that 5,979, 4,475 falls within the categories as defined by the collective agreement between the employer and the unions, because there's a collective agreement which defines the categories of teachers who should qualify for the concession. It lists the illnesses that make one to be more at risk insofar as COVID-19 is concerned. So out of this 5,979, 4,475 fall within that category. Then the remainder are teachers who have indicated that they have other forms of illnesses that are not covered in the collective agreement. And those applications have been received and referred to the health inspector, to its health risk inspectors, who will then give us advice on whether to approve or decline those applications, because they fall outside the collective agreement. Let me also indicate that of the 4,475, which falls within the collective agreement, not all of them really will be completely at home. Some arrangements have been made with different teachers from different schools to, for example, come during your lesson, teach and then go home. If we have 2 lessons, you come, you teach one. If the other one is an hour later, you stay in an isolated area, you teach the second one, and then you go home. So there have been those arrangements that have been made, and we really thank the educators for cooperation, because it indicates that they don't really regard this as leave also. They want to be part of the system. They want to come and teach our learners, but for the illnesses that they have, they had to go through this process of the application for concession. The last point there is that those who will be completely at home, who will not be able even to come to teach during their lessons and leave, there are posts for substitute teachers, which have been made available. I think we've made just about 2,000 posts for substitute teachers to therefore take the spaces of those educators, so that there is no learner that is left in a classroom without a teacher. I think those were the questions that were asked. Thanks.
Good afternoon, ladies and gentlemen. Afternoon, Premier, MEC Kwazi Gwenkosi Mshengu, all colleagues that are here today. Good afternoon. See, I'm happy today. I only have one question, so I can mess around with everyone or anyone. No, thank you very much. We just had one question today that was referring to what is our plan in relation to the field hospitals, particularly that are of our facilities. I think that's what the question talks to. The first thing that we need to indicate is that we had signed contracts with the majority of the centers that are hosting us, and contracts that are diverse. Not all of them are standard. So there will be a level of contractual obligation on some of these facilities that we are going to have to adhere to. However, as the department, as of early last week, we had started looking at the different facilities in the different districts to try and engage with those that we have contracts with to see if we could get out of the contracts. For instance, when you speak to Utugela district, we had 3 sites that we had contracted with. 2 of the 3 sites belong to government. One is Titima, the other one is sorry, I've forgotten the name. So, but we've got 3 sites, and 2 of those belong to government. So already we are negotiating and downscaling, and our plan is that out of all the sites that we have, at least let's remain with 1 site that we could pay for, and then we can engage with the different owners on how best do we move forward. So we've started doing that in all the districts. There are areas, however, that indicate that is clear that we might not be able to shut down immediately. One of them is the Royal Showground Center, because we've invested quite a lot of money there. But besides the fact that we have invested, it's actually very operational as an operational hospital. So as we continue, we will be using it probably for as long as the infections are there, and for as long as the surge keeps coming up as a province. But we do want to also indicate that while we've noticed that in the past week or 2, our numbers as the province of KwaZulu-Natal have been going down, we must also keep in mind that we have been warned by scientists that there might be a second wave. So while we've got these facilities, we are also bearing in mind in our planning that should there be a second wave, what do we do? That is why we are not going to be shutting down all the temporary structures of the facilities that we are utilizing outside of the Department of Health. But it also makes us excited that the majority of the facilities that we created were within our own facilities, which means should we really see a downward spiraling of the numbers, those facilities that we had created within our own hospitals, we can then start utilizing them for other clinical needs that we might have. So the reality is that yes, we are starting to consider shutting down some of the facilities, but it's not all of them that we are going to close down, because we don't want to find ourselves in the back foot should there be a second wave, and should the second wave be able to hit us very hard.
Premier, but I think while I've not been asked any question, it would be very remiss of me not to raise this issue. While level 2, or while all of us are on level 2, we have found that our people have started behaving as if we are a free of COVID country. We really wish to call on our people to adhere to the regulations. We call on our people to wear their masks, to social distance where they are supposed to be doing so, and to make sure that they wash their hands or they sanitize their hands should there be a need. In other areas, particularly areas that are owned by business people, we sometimes have seen in the past couple of days that not all restaurants, not all people who are selling alcohol are actually adhering to the regulations. We really call on our people, particularly on business owners, that let's call out their conscience to make sure that while they proceed with their economic activity, which is, by the way, necessary for the province and themselves, but let's make sure that the regulations that have been put in place are actually adhered to, because should that not happen, it means in the next few days we are going to again see an upsurge of people that are infected, and I don't think that is what we want as a province of KwaZulu-Natal. Thank you very much, Bambakas.
Thank you. Yes, welcome the Premier, the Honourable Premier, who is going to respond and summarize for us in Zulu. Thank you.
No, thanks. With regard to the question about the investigation on PPEs, we must report that the investigation we did was with regard to the Department of Social Development, and those who were found involved are now suspended and are going through disciplinary actions. The rest was to present a report in detail. We presented a detailed report of the procurement that has been done by all departments, and that is still available on our website. And having answered that question, and to summarize in Zulu, siyafisa uqala ngokubonga abezindaba ngomsebenzi abewenzayo ukuqhubeka njalo besilekelela ukuxhumana nomphakathi nokufundisa abantu ngale challenge esibhekene nayo ye-COVID-19. Kusasa mhla ka-24 ka-August, izikole zonke zalapha KwaZulu-Natal zizobe ivula ukuthi bonke abafundi babuyele esikoleni. Abafundi abangapheka 2.8 million bazobuyela ezikoleni ezicela ku 6,148 la KwaZulu-Natal. Kodwa ukubuyela kwabo kuzoshiyelana ngoba kuzoba nama-grade abuyela kusasa, abanye babuyele ngoLesithathu, kuye ngokuya ngokwe-schedule esibekwe i-department nezikole ngokuhambisana nokuthi i-department izilungiselele kangakanani. Kodwa siyafuna ukureport ukuthi uMnyango wezeMfundo KwaZulu-Natal usuwenze konke okufanele ukulungiselela ukuthi abantwana babuyele esikoleni. Singaqinisekisa ukuthi umntwana ozoya esikoleni kusasa uzogoduka enama-mask amabili, futhi esefundisiwe ukuthi ama-mask kudinga wasebenzise kanjani nokuthi awafake throughout i-period yokuba sesikoleni azabuyele ekhaya. Singaqinisekisa futhi ukuthi umnyango wenze konke okusemandleni ukuqinisa ukuthi amanzi ayatholakala ezikoleni. Enye yezinto umnyango wezemfundo oyenzile ukuthi ufake ama-boreholes ezikoleni lapha KwaZulu-Natal. Izikole ezicela ku-600 seyihlonzwe ukuthi zizofakelwa ama-borehole ngokusheshsha. Kanti umnyango uyaqhubeka ukuhlonza ezinye izikole ukuthi zinazo yini indawo ezinamanzi ngaphansi la ungasetshenziswa khona uhlelo lwama-boreholes ukuze kutholakale amanzi. Umnyango ucontracte i-Department yakwa-Public Works no-IDT ukuthi bakwazi ukwenza lo msebenzi. Ngokunjalo sibonile ukuthi eyindaweni eziningi ukunikezela ukudla bekwenziwa eyindaweni ezingekho esimene esigculisayo Yingakho futhi umnyango buye wa prioritize ukuthi akuthuthukiswe kumbe kulethwe ama mobile kitchens kuzo zonke indawo la kubonakala khona ukuthi isimo asisihle. Ngokweinamba zokutheleleka kwabantu bakithi ngeCovid-19 singasho nje ukuthi izolo ngomgqibelo besi umgqibelo lo womhla ka22 si register ama cases angu 4713 new cases kusukela ngumgqibelo odlule. Okusho ukuthi ukunyuka kweinamba nokho akusekho nzima kakhulu ngoba bekuvame ukuthi ngosuku sireporte inamba ezithi asibheke ku3000. Njengamanje sinabantu abangu 2276 abasishiyile kuyisukela ngesonto elidlule kuze kube umgqibelo wayizolo ngenxa yalesifo seCovid-19. Ngokwezibalo zizonke abantu abanale asebetheleleke ngalesifo kusukela ngoMarch kuze kuzoba uAugust bangu 109,332. Kanti abantu sebeshile emhlabeni ngenxa yezifo ezixhumene nalokhu bangu 1949. Siyajabula ukubona ukuthi u78% wabantu urecovered. Uma sithi u78% ngokwezibalo eziphelele abantu abangu 85,055 aseberecovered. So i-recovery rate yethu yinhle kakhulu. Kodwa noma kunjalo siyafuna ukusho ukuthi asikakaphumi engozini. Wonke umuntu salindeleke ukuthi alandele imigomo ngokuyikho. Kusiphatha kabi ukuthi kengicetshwayo umubheka inamba ireport inamba ethe ukuba phezulu kakhulu. Kanti futhi nakuma deaths ireporta ukushona kwabantu okuthe ukuba phezulu kunamanye ama district. Yingakho ke sifisa ukuthi nakubona bonke abantu bazi ukuthi isifo lese COVID-19 singozi masizivikele ngokwemgomo ebekiwe. Ngasho ukuthi ama cases esewonke ama cases esiwarithole izolo angu 549 kodwa izibalo zonke zabantu nje asebeke batheleleka zingu 109,332 with 1,949 deaths. Abantu abashile emhlabeni abangu 1,949. Siyafisa ke ukugcizelela. Siyazi ukuthi njengamanje ukusebenza komnotho sekuvuliwe. Siyabonga ukuthi amahotela, ama-restaurant nezindawo ezihlukahlukene ebeyivaliwe seyivuliwe. Kodwa siyagcizelela ukuthi lokho akusho ukuthi impilo isishintshile yabuyela esimeni esidala. Instead kumele manje sifunde ukuthi sizophila nalo leli gciwane liphakathi kwethu kodwa kuye ngokuthi sizivikela kanjani. Siyafisa abantu abasebenzisa uphuzo ukuthi uphuzo oludakayo abalisebenzise responsible. Nabalidayisayo mabaqhekele ukuthi balidayisa ngendlela futhi bayabagcizelela kubantu ukuthi balisebenzise ngendlela eindaweni ezifanelekile. Umuntu angaphuzi angene emotweni adrive, umuntu angaphuzi ahamba ekhaya ayohlukumeza abantwana nomama. Siyacela futhi ukuthi abantu abazwa benama symptoms impawu zokuphathwa yilesifo seCovid-19 basheshe baye esibhedlela eziseduze nabo. Kusiphatha kabi ukubona abantu bedlula emhlabeni ngoba bafike ezibhedlela sekulate. Siyagcizelela lokhu njengohulumeni silungise izibhedlela eziningi lapha kwaZulu Natal and sisenembhede eminingi yokuthi sikwazi ukuhlenga impilo zabantu abahaqekayo ngalesi sifo. Siyazi ukuthi abahlengikazi bethu nodokotela endaweni ezihlukahlukene bayithola betheleleka ngalesifo kuze kube manje la kwaZulu Natal bangu 5,885 abasebenzi bezempilo abahaqwe lesi sifo. Kodwa siyabonga ukuthi u60% wabo usurecovered. Nakuba kusiphatha kabi ukuthi u1% walabo baye baba infected uye wadlula emhlabeni. Masibongele umntwana wakaphindangene uPrince Mangosuthu Mthelizi ngokuthi urecoverile kulesi sifo. Bekusiphatha kabi ukuzwa ukuthi akekho ukuthi ungenwe yilesi sifo ngenxa yokubheka iminyaka yakhe, kodwa siyabonga ukuthi uNkulunkulu uyiphendulile imkhuleko yesizwe wamsindisa. Ngaphezulu kwalokho siyazi ukuthi kuleli sonto ngolesine uzohlanganisa iminyaka engu92. Siyamhalalisela futhi simfisela usuku lokuzalwa oluhle. Siyazi ukuthi as siqhubeka abantu bakithi singena ku level 2, abaningi abantu bayitshene ukuthi mhlambe sekuvulelekile and therefore impilo kudinga ibe normal. Cha, isifo se-COVID-19 sikhona siphakathi kwethu. Kukuthina ukuthi si-embrace kusamukele lokhu okubizwa ngesimo esisha sokuphila, a new normal. La esithi asiphile khona sigwema ukutheleleka ngalesifo. Masiqinisekise ukuthi sifaka ama-mask njalo masiphuma siya emphakathini. Uma uvakashele ekhaya kanti awuhlali khona, musu kuyikhipha imask ngoba uzobe usuthelela labo obafice ekhaya. Masiqinisekise futhi ukuthi sisebenzisa isanitizer, siwasha izandla ngensipho namanzi njengoba kushiwo isikhathi nesikhathi. Uma siye emphakathini masishiyelane ibanga elingamabitha 2 ongenayo. Siyafuna ukugcizelela ukuthi i-compliance iyona nto ezosilekelela. Ukuhagana nokuqabulana kwabantu akakamukeleki. Kuze kube manje siyafuna ukugcizelela lokho. Abaphethwe yizifo lezi ezidinga ukuthi bathathe imishanguzo, imedication, the phecelezi chronic disease like isifo sikashukela, HIV and AIDS nezinye, siyacela ukuthi bathathe imedication yabo ngokufanelekileyo. Ngalokho ngikholwa ukuthi ngakwazi ukubamisana ukugwema ukuthi lesi sifo sisibhuqabhuqe. Ngokubamisana sizoyinqoba i-COVID-19. Ngiyabonga.
Thank you very much, Honorable Premier. I think we have covered most questions. There are no more new questions being asked. We request to adjourn for today until next week. Thank you very much.